Can automated prompts help clinicians reduce unnecessary extended-spectrum antibiotic use? What are some important characteristics of non-oncology accelerated approvals by the FDA? What should clinicians know about early-onset GI cancers? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, July 18th, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by fellow JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started with the JAMA research letters published this week.
Hi, Linda. JAMA published some important follow-up results from the INSPIRE trials, which included 4 separate cluster randomized trials previously published across the JAMA network. These trials evaluated empiric antibiotic selection in adults hospitalized with common infections like pneumonia, urinary tract infection, abdominal infection, and skin and soft tissue infection. The original trials showed that computerized provider order entry prompts helped limit the use of extended spectrum antibiotics when the risk of resistance was low. This week's research letter investigated whether these findings were sustained. The authors evaluated extended spectrum antibiotic days of therapy after the third hospital day across all 4 trials. And they found that these computerized provider order entry prompts resulted in sustained reductions of empiric extended spectrum antibiotic use for the entire hospital stay.
Interesting. And speaking of antibiotic stewardship, there is a patient page this week that talks about antimicrobial resistance. It includes information about common microbes and how to reduce the spread of antimicrobial resistance. Up next, Dr. Liu and colleagues used FDA database information to better understand the FDA's use of accelerated approvals for non-oncology products from 2013 to 2024. Their research investigated different characteristics of these products, such as indicated treatment conditions, time to conversion to regular approval, and any significant differences between pivotal and confirmatory trials. The authors found that a third of the pivotal trials reported clinical outcomes as primary efficacy endpoints, even though the decision to grant accelerated approval was based on surrogate marker endpoints. They explain that this can make the drug's clinical utility uncertain, despite the change in regulatory status.
There's also a JAMA editorial about the role of molecular mechanisms in pediatric asthma exacerbations. It accompanies a recently published article by Dr. Altman and colleagues in JAMA Pediatrics. In the editorial, Drs. Powell and Debley explain the trial's contribution to translational medicine and how it can provide insights into the important nuances of pediatric asthma.
Drs. McBride and Richmond contributed a JAMA Viewpoint in which they discuss medical staff bylaws and ways these policies can help to preserve physician autonomy in clinical care.
There's also a viewpoint from Drs. Prasad and McCary from the U.S. Food and Drug Administration. They explain the class safety warning for myocarditis and pericarditis recently added to the COVID-19 mRNA vaccine prescribing information. This week, there's a JAMA review about lower urinary tract symptoms in men. Dr. Wei and colleagues summarize helpful definitions and evidence-based practices. The review offers an excellent evaluation and management algorithm, and in this week's JAMA Clinical Reviews podcast, Dr. Wei discusses the diagnostic opportunities for patients with lower urinary tract symptoms. Here's more from Dr. Wei.
We start with evaluation of the symptoms themselves. The easy thing to do is to measure the symptoms, quantify the symptoms with something like the International Prostate Symptom Score. In my practice, we actually have patients fill it out on an iPad. It goes right to our EMR, and when I see the patient, it's already there. So evaluation of symptoms are important. We typically will look at things like their bladder residual, bladder ultrasound to see if they are in urinary retention objectively. Other testing that we do, like cystoscopy, checking a PSA if they're in the right age group for prostate cancer screening, those are more depending on the symptoms that the patients have, whether or not they will have more testing like that.
And Dr. Jaya Krishnan and JAMA Associate Editor Dr. Kimmy Ng contributed a review this week about early-onset gastrointestinal cancers. The authors explain why this is a timely topic, as the incidence of GI cancer diagnosed before the age of 50 is rising globally. Learn more about the risk factors, diagnosis, and caring for patients with early-onset GI cancers in this article. And listen to hear more from Dr. Ng in conversation with JAMA Deputy Editor Dr. Kristen Walter on another episode of the JAMA Clinical Reviews podcast. Here's a clip of their conversation.
So ever since the mid-1990s, there has been an increase of about 2% per year in both colon and rectal cancer in both men and women. And the reasons for this are largely unknown. Similarly, along the same time frame, we have recognized that the incidence of pancreatic cancer and esophagogastric cancer, as well as many biliary tract cancers and appendix cancers, have also been rising in very young individuals. And the key theme kind of threading through these cancer types rising in the young onset population is that many of them are linked to obesity and other environmental factors. And so there's a lot of research going on right now about what the underlying causes may be for this rise in early onset cancers.
Patients with chronic kidney disease are at an elevated risk of morbidity and mortality. In this week's JAMA Clinical Guidelines synopsis, Dr. Song and colleagues discuss the recent guidelines developed by KDIGO earlier this year in April. These guidelines can assist clinicians in their efforts to delay the progression of kidney disease.
Thanks, Linda. And don't forget, you can always find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.